Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Strokes in children are not common, but when they do happen, timely care is crucial to minimize or eliminate long-term consequences. Today, we'll hear about the plans in place at the Upstate Golisano Children's Hospital to quickly identify and treat pediatric strokes from Nurse Jennifer Murphy. She is the Pediatric Resuscitation Program Manager, and she led the team that created the Pediatric Stroke Pathway at the Upstate Golisano Children's Hospital. Welcome to the Informed Patient, Mrs. Murphy.
Thank you for having me.
Now, what causes a stroke in a child?
There are many causes. They are different than adults just because as you get older, we have more problems. We have different things in our arteries that can cause people to have strokes. So the children, it just depends. Sometimes there's some underlying problems that put them at higher risk. But because strokes are rare in children, there's still a lot of things that we have to learn from what causes them and why are we seeing a higher incidence nowadays.
So in adults, at least, I've heard that there's generally two types of strokes, either caused by a blood clot or by a rupture of a blood vessel. Is that the same in children? Could it be one or the other?
It sure is. Yeah, we have seen strokes in children where we have it as a blood clot or that there has been some reason that a vessel is ruptured and then we have bleeding in the brain that can also cause a stroke. We certainly see both types. Little babies tend to have more bleeding type strokes, but they certainly can have clot strokes as well.
Do children have risk factors like adults might have risk factors for stroke?
Certainly, and that's back to like some of the things that cause strokes. Some of our congenital heart defect patients put themselves at a higher risk due to the nature of their heart problems. There are also patients with different vascular abnormalities. There's a common one called moyamoya disease, and there's adults that have it as well. Those are patients that we can see to have a higher incidence of stroke. Patients with sickle cell potentially can have stroke, and also people with clotting disorders. Obviously, those put themselves at risk for blood clots all the time, but all those things are some of our higher risk population. There certainly can be different medical conditions, acute illnesses that people could get sick with that could put them at a higher risk for a stroke. There's definitely a long list of things that can. We know some things are more risky than others.
And do you see patients that don't have any of those risk factors, that it's just a total surprise?
We have, unfortunately, we have had patients, and once they have a stroke, we have quite the workup that gets done from testing for different clotting disorders, bleeding disorders, underlying defects. Is there a heart defect that we didn't know about that allowed a clot to pass through? So we certainly do a full workup, and sometimes it takes a while, right? Like I said, medicine is science, but it's also a little bit of a game where we have to check off a lot of things it's not before we get down to what it actually is. So sometimes it takes a little bit of time. Sometimes we have to send out some genetic things that take a lot of time to come back. So these patients, once they have a stroke, will get a full workup to try our very best to determine the underlying cause of their stroke.
The Upstate Golisano Children's Hospital has what's called a clinical pathway or a plan in place that is sort of a roadmap of care for kids who are having strokes. What can you tell us about it?
This was created 2 years ago. It took almost a year to make. A lot of the children's hospitals, we share a lot of our pathways, and all of our clinical pathways are on our website and publicly available. And when we built this pathway, I reached out to a lot of the children's hospitals because with strokes being rare and something newer that we are all trying to have guidelines for, this is like precisely what you said, a roadmap. And we call it a clinical decision tool. It helps us identify from everything that we can gather for what information is out there on pediatric strokes. We have certain criteria that say these things will provide us the highest risk that this is a stroke in a pediatric patient. And what we want to do, the whole goal is identify these fast so that we can get imaging done fast on their brain to see if there is a stroke. Because if there is a stroke, depending on the type of stroke, and the last time, we always call it the last known well. You hear that a lot with adult strokes too. Like, when was the last time you saw them well and what they normally look like? There's a window to treat with our medicine that will break up the clot, and that window is 4.5 hours. And part of this pathway to bring recognition not only in our own institution, but outside of our hospital to all of our surrounding regional hospitals is that we need to think about strokes in kids because that's a tight window. And usually parents aren't thinking about strokes in kids. I am a parent It's not something I want to think about at the forefront. I do this for a living, so everything's at the forefront of my brain. But oftentimes, when they're coming into the hospital and seeking care, we are pretty far into that window. So the faster as us as healthcare professionals can identify that this is potentially a stroke, get the MRI, which is ideally what we would like to get done on their brain, and determine if it's a stroke or not. And that's what the pathway is meant to be: simple, to guide you through the process, remind you the process, so that we can treat them if we're still within a good opportunity of that window.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with nurse Jennifer Murphy. She's the Pediatric Resuscitation Program Manager at the Upstate Golisano Children's Hospital, and we're talking about pediatric stroke. What specialties are part of the pediatric stroke team?
To build this pathway took a lot of teamwork and collaboration, because we have our frontline providers, right? A lot of these patients are coming through our ED, but it could be a patient that's already in our children's hospital that starts showing stroke symptoms. So we have to get all of our frontline staff involved. Obviously, neurology is a big one. So we have our neurology residents, and we have our head doctors, our attendings, that are also involved. You have radiology, pharmacy, our nurses, our respiratory therapists if we need them, if the patient's having some trouble with their breathing. We have our oncology doctors who also do our hematology disorders or our blood disorders, because if this is a clotting thing or a bleeding thing, they're going to need to be involved for part of the workup. Then cardiology, because we want to do images of their heart to see if there is some kind of hole in their heart that was maybe missed that allowed the clot to go through. It was a huge undertaking to bring everybody together. It took teamwork and collaboration, right? Pediatric anesthesia was also involved, because if these patients are having trouble to sit still for the MRI, then we need to potentially give them a little anesthesia to help them sit still for the MRI, because we want to be able to see those images nice and clear. We have created here at Upstate, long before this pediatric stroke pathway, a shortened MRI with a certain series of images. The normal brain MRI is quite long for a patient to sit through. And so this is shortened. So it only takes us about 12 minutes to get the images. So we are more apt to be able to get them done without having to use anesthesia on the patients, which is great. And part of the reason why this has been so successful for us.
Since the program began in February 2024, how many times has it been activated?
We've activated it 41 times, and we've made tweaks. And as these activations have gone through, we've updated the pathway.
Well, let's talk about how this works when a child is suspected of having a stroke. I know that you said they may come into the emergency department, or they may already be a patient in the hospital. But what are the signs and the symptoms that the patient may have that would make someone think maybe they're having a stroke?
These symptoms a lot overlap with what we see in adults. Really, like one side of the body could be drooped, their face could be drooped, they're not able to use one side of their body, or one side is tingly. They could have some vision problems. But it's hard with kids, right? Like a 2-year-old's really not going to be able to explain to you the same thing that an adult's going to come in with the symptoms. So really, a lot of times it's the parents picking up on something's not right. But then your kid stumbles and we're like, oh, your kid's clumsy, right? Like my daughter's very clumsy, and I try not to tell myself that there's something bad happening all the time. But that's what we do as parents. We know that children are clumsy and they fall down. So we're looking for those things. And the other things is kids' bodies are incredibly resilient, which is why I love working in pediatrics. Their brains will and their bodies will try to make up for and compensate for these things that are happening in their body. So they're going to give you more subtle signs than you're going to see when an adult presents. So really, we have those things. A lot of our stuff that you activate the pathway for are those things that you are seeing with one side of the body, maybe potentially feeling a little different or being weak. Their vision, they could have some vision losses, having trouble speaking or not being able to speak at all. So you're still seeing a lot of the same symptoms that you're seeing in adults.
Is it painful for the child?
I don't know as much painful as anxiety provoking, right? Especially if you're thinking the younger kids, they have no idea what's going on in their body. But even for a teenager, it's still scary too, because all of a sudden their body's not working right. And it is quite scary for them, and not knowing, especially if they're having trouble speaking or not able to speak. I couldn't even imagine, even as an adult, what that would be like. It'd be anxiety provoking. So I think it's more scary for them that their body's not acting the way it should.
Is this pathway that you've worked on, is it the same for a 2-year-old as for a 17-year-old?
It is in the way that we activate it and need to get the images of the brain. It's a little easier to convince a teenager, older kid to sit still for an MRI than it is a 2-year-old, 3-year-old, 4-year-old. But that's everything in pediatrics, right? We have a wide range of ages. And so that developmentally, it's going to be challenging. That piece will be difficult. But as far as everything else, the medication we give to break up a clot is all based on how much they weigh. So, and that's how every medication is in pediatrics. So that is no different. But essentially, from top to bottom, that pathway, no matter your age, is going to fall exactly the same.
You mentioned medication. So if a stroke is confirmed, is medication the primary treatment?
It just depends. It depends on what we're seeing that caused the stroke, how far we are into that window the last time they were known to be well. And there is quite the long list of things that would not allow you to get the clot busting medication that would break up that clot. And a lot of that is the same as it would be for an adult to get it. Granted, adults have a lot more underlying problems that would exclude them more. So in general, most of these kids are healthy and able to get the medication. The tough part is recognizing it early enough within that 4.5 hour window for us to be able to give it.
What is recovery like for a child who has had a stroke and goes through the treatment and recovers? What is life like after recovery?
It really depends on how well we were able to treat, right? If we're outside the treatment window, if the brain did take some damage, there's going to be some rehab needed, especially if they have one leg that's not working as well or one arm, or if they're having some swallow problems. So it can be as great as the patient who got the clot busting medication and left here with no problems. That's perfect, right? That's ideally what we want to see. Rapid recognition, quick treatment, and then their brain's fine. But sometimes there is some lasting deficits there. And then we do have a nice rehab unit here where the patients can go after they've medically been cleared from the hospital. It's still within the hospital, but we discharge them to bring them down there. It's like an inpatient but outpatient type unit. And they go down there and then they get really good routine everyday physical therapy, occupational therapy. They can get speech therapy. And we see kids who go down there with some issues after having their stroke do very, very well when they get that routine therapy. And then usually we'll go home after some time and continue to see them and get those therapies after they go home. And it's the same as an adult, really. It just depends on how much damage, how long the damage was there for. But most people will inevitably probably need some rehab. And we'll start the rehab when they're up in the children's hospital. And sometimes they're good enough to go from there to home and just do outpatient services.
Do you know if having a stroke as a child means that you're at risk for having another one as you grow older?
There are certain designated windows where you're higher risk, right? Immediately after a stroke, you're kind of higher risk to stroke again. But it really just depends on what the underlying cause is. If you have a clotting disorder, you're probably lifelong going to be at risk for clots and potential strokes. But in general, it's really going to depend on what caused it for us to know the risk for lifelong. A lot of these patients will go home on like a baby aspirin until neurology deems that it's safe enough for them to come off just as a preventative measure.
Well, Mrs. Murphy, I appreciate you making time to tell us about the pediatric stroke clinical pathway. Thank you.
I appreciate it. Thank you for taking the time to learn more about it so we can spread awareness.
My guest has been Nurse Jennifer Murphy from the Upstate Golisano Children's Hospital. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.